In this week's video, we're looking at acne. It's time to learn all about the different lifestyle changes that you can make to prevent it from getting worse, as well as looking at treatments and why it happens and everything you need to know about acne. Let's begin. So this video is going to be jam-packed full of information, so if at any point you want to find any specific information, feel free to click on that description below. It's all chaptered. Find what you want, click on it and watch it. However, I'd always recommend that you watch the entire video. Okay, so let's begin with lifestyle changes. Let's get stuck in. Tip number one, the first thing I want to ask you is how often are you washing your face? Look, if you have acne, a lot of patients tend to overwash. So please do not overwash your face. Maximum you're looking at per day is twice a day, and even that's a bit too much. Once a day is perfectly enough, so make sure you're not overwashing, because all you're going to really do is aggravate the skin, inflame the skin, make things worse. So don't overwash, and make sure you're not using any exfoliating things to wash at all, because again, that's just going to aggravate the skin. Now in terms of what to use, I'd highly recommend that you just use a simple gentle cleanser, okay, and use lukewarm water. Don't use really hot water. Don't use the exfoliating stuff that I just spoke about as well. Just a gentle cleanser will do. Just be gentle, don't rub too hard, and once you're done, pat your skin dry, okay? Don't rub it again, just pat it dry. That's a really important thing that you need to do. And as well as that, I know some people with blackheads tend to think that all blackheads are due to not cleaning enough, but in fact, the reason you get blackheads is just because it oxidizes, the oil plugs oxidize, and then they become these blackheads. It's not because you're not cleaning enough or washing enough. That's just the natural process that occurs. And for those of you who wear makeup, please make sure that before you go to bed, you wash all the makeup off with the gentle cleanser and the lukewarm water, exactly how we described earlier. Again, make sure to pat it dry, don't rub it dry. If you do wear makeup, please also look for the words non-comedogenic or non-acnegenic on the actual packaging. This means that it's not going to block them pores and potentially cause more acne, more blackheads, more whiteheads, all of the stuff that we don't want. Now, washing your face can leave your skin a little dry, so if you're moisturizing your face, please make sure that you're using a fragrance-free, non-oily moisturizer. Also, again, look for those words, non-comedogenic, on the actual product, because that's not going to cause that blockage to the pores and again make the acne worse. Another pro tip as well that I want to make you aware of is during the day, look for an SPF 30 sunscreen. And the reason I'm saying to use an SPF 30 sunscreen is the sun can damage the skin and make the pigmentation worse, and also potentially make the acne scarring worse, because it's not going to allow the skin to heal as well. So it's a really useful thing to wear a sunscreen during the day, especially if you're quite prone to acne, just to reduce the scarring and to reduce the pigmentation. Again, look for those non-comedogenic products. Now, the next thing that I want to discuss is your hair. Look, we all go for a shower, you're going to wash your hair with shampoo, that's fine. The thing about hair that I want to discuss is make sure that your hair isn't covering your face or parts of your face, because the hair and the oils can actually make the acne worse, okay? And if you are prone to acne on certain areas where your hair is sort of covering your face, have a good think about it, because that could potentially be making things worse. So try and tie it up, or when you're going to sleep, for example, as well, try and tie it up as well, because what happens if you go to sleep and it's not tied up is it ends up going all over your face, and all those oils end up going on your face as well, which could potentially make the acne worse as well. So really do think about that. And this moves on nicely to sleep, and I really want to talk about your pillowcase. How often are you changing your pillowcase? I really want you to think about that. I would highly recommend it. If you're someone who suffers from acne at the moment and you've got quite bad acne, change your pillowcase every single day. The reason I'm saying this is when we go to sleep, all the sweat glands, all the pores, everything goes onto that pillowcase, and the bacteria starts to grow on it, and it could potentially make the acne worse. So look at maybe buying 7 pillowcases or whatever and rotate them, or 14, and then wash them once every week and then keep rotating from there on, okay? This can make a really big difference. I do that myself personally because I suffer from acne as well, and I think it made a massive impact. So I'm just making you all aware of it as well. Now, the next point that I want to discuss is picking those spots. Please do not pick or squeeze those spots. All it's going to do is put you at a much higher risk of scarring, and I'm sure nobody wants that. It can also put you at higher risk of infections as well, and I'm sure you don't want that either. Now, if you do have quite a big spot, you can look at buying a few hydrocolloid plasters. These can be quite useful at covering certain spots, and they can help with the healing process for it to happen faster as well. Now the next point that I want to discuss with you is diet. Look, there's been some pretty good research recently showing that certain foods can potentially make acne worse, which is really interesting because a few years ago we never used to recommend this sort of stuff. So the first thing I want to say though before we move on to that is look at maybe keeping a food diary. You've all got one of these, you've all got a phone, I'm sure you do, or you can do pen and paper, whatever's easier for you. Keep a food diary and see if you can find any correlation between certain things that you eat and having an acne breakout. The other point I want to make as well is please do not stop eating certain food groups or anything drastic like that without speaking to your healthcare professional first. If you are thinking of doing anything like that, speak to your healthcare professional first, make them aware and get the thumbs up from them. So generally speaking, people that eat a lot of sugar, white bread, potatoes and rice can potentially make their acne worse, okay? So I'm not saying stop these foods completely, but it might be a good idea to eat a bit less of them and see if it actually has an impact on your acne. Maybe do each one for about 2 weeks and see if there is a correlation between reducing the amount of, let's say, rice that you eat and the amount of acne that you're getting. That's why the food diary is so important for this kind of thing. Now there is also some evidence that milk and dairy products may make acne worse. So if you are thinking about stopping these, you will need to replace them with a non-dairy alternative, such as oat milk, such as almond milk, anything like that as well, because you still need to get that calcium because it's super important, especially if you're growing as well and you're a teenager. Calcium is really important for you in this stage. So don't just think, I'm gonna stop dairy completely. You need a replacement as well. So now that we've done with the diet related stuff, the next thing I want to discuss with you is stress. Look, we know that stress can potentially make acne worse. So if you're quite a stressful person, if you're going through a lot as well, you might need to learn some stress busting techniques, okay? And the good news is I have quite a few videos on this topic already. I'm not gonna go through it in this video, but if you do want more information on how to reduce your stress levels, on techniques that you can do to help with it, I will leave links to it up here and in the description below. Feel free to check it out. And whilst we're on the topic of stress, I also want to mention if you feel like your acne is making your mood drop, if you're feeling low, if you're having negative thoughts, if you're having thoughts of self-harm, suicidal thoughts, if you're not wanting to go out as much, if you're losing interest in a lot of things that you do, your hobbies that you do as well, that you used to find fun, if you're not seeing your friends as much, all these things, any of these kinds of symptoms that you're having, please, please, please speak to your healthcare professional about it. Don't leave it. Speak to your healthcare professional, make them aware of it because acne can affect people's mood. This is normal as well. And moving on to my final lifestyle tip, if you smoke, you need to quit smoking. It's as simple as that. We know that smoking makes acne worse. It also causes many, many different health complications and problems that I'm sure nobody wants. So if you do smoke, please try and quit. Now the good news again is I have a video on how to quit smoking. I go through all the different techniques and everything you need to know, and to be honest with you, it's helped a lot of people out there. So if you do want to quit smoking, if you do smoke, please feel free to check out that video. I'll leave it up here and in the description below. So now we're going to move on to the treatments of acne. I first thought we'd go through the lifestyle stuff that everyone can really do, and then we'll move on to treatments. So let's look into it. Okay, so let's begin with treatments. The first thing I want to tell you is I just want to bust a myth out there because I've seen quite a few videos of people doing this and it's really not good for you. Please do not use toothpaste on your acne. If you have a spot, please do not put toothpaste on it. All it's going to do is potentially make the acne worse and cause scarring. So please stay away from the toothpaste. Just use the toothpaste to brush your teeth. Don't put it on your skin. Let's talk about the treatments now. So one of the most common treatments for acne is actually a cream that contains benzoyl peroxide. Now benzoyl peroxide can only be purchased from a community pharmacy, so you will have to go there, speak to the pharmacist so they can make sure that you're safe and suitable to use it. But if you do then start using it, benzoyl peroxide can be really useful for pigmentation, for acne, and to prevent the acne from coming as well. So it can be a very good cream, but it does have some few side effects as well that you should be aware of, such as skin irritation. That is very common with it, and it can dry the skin as well. So as a result of it being quite a strong cream and causing a bit of dryness of the skin and irritation, it's usually recommended that you start it slowly and build up, usually once a week or twice a week, and then slowly building up. Now, this is a bit complicated to go through in this video because it's going to make the video quite long, but I do have a video specifically, solely all about benzoyl peroxide. So if you do want to learn more about how to use it, it, when to use it, and how to increase it slowly, I will leave a link to it up here and in the description below. And it's important to remember that most acne treatment can take up to 2 to 4 months for it to have its full effect. This gives it the full cycle of the skin cycle to actually show its effect, so give it time. There are also other treatments available which are prescription only, so you will need to speak to your healthcare professional about them, such as different creams, such as antibiotics, retinoids, isotretinoin. There's loads of treatments out there, but you will need to speak to your healthcare professional about them so they can review you, make sure that everything's okay, make sure you have no side effects, and make sure that it's suitable for you. Now again, I also do have a video all about isotretinoin, so if you do want more information on this, I have a full video about everything you need to know about isotretinoin. So if you're interested to find out more, if you've just been prescribed it, or if you just want to find out a bit more information, feel free to click up here and in the description below to find out more. And please do remember, once again, these treatments all do take a bit of time. You need to keep going with it. You can't just give up because you're not seeing the benefits straight away. They can take up to 2 to 4 months again to show their full effect. However, I just want to say it again, if you feel like the acne is making your mood drop, if you're feeling lower than usual, if you feel like you don't want to participate in activities that you used to take pleasure from, if you're having negative thoughts, if you're having suicidal thoughts, any self-harm thoughts, you need to speak to your healthcare professional, and that's the most important thing. So now that we know all about lifestyle changes and we know about treatments, the next thing I want to talk to you about is what actually causes acne. What's causing this to happen? So for most people, acne usually starts during puberty, and you can get acne anywhere from the face, the back, the neck, the chest, and it's completely normal. If you do have someone in your family that's had it, someone quite close to you in your family that's had acne, you're far more likely to have it as well. So the next question is, what is causing the acne? Well, we all produce oil from our skin. I do, you do, everyone that's watching this video does too. And the oil comes out of something called the sebaceous gland. Now, when we're going through puberty and we have certain hormones, increased levels of these hormones, it sometimes causes more of this oil to be produced. It kind of goes into hyperdrive. We're getting more and more oil production through the sebaceous glands, okay? And once this happens, we sometimes have dead skin cells directly above the sebaceous glands, and this oil then gets blocked in there, and eventually it can cause spots such as acne, such as whiteheads, such as blackheads. All of these can be caused by these blocked sebaceous glands. And sometimes these pus-filled bumps that we just spoke about can get bigger and be really painful under the skin, which are known as nodules and cysts. And if you do have these, you definitely need to speak to your healthcare professional about them if they're not already aware of it. There's also a bacteria that lives naturally on our skin which thrives off this oil production, and then it causes the inflammation, the swelling, the redness, the hotness, the touch. It's all being caused by this bacteria as well. So it thrives off that oil production, and it causes all the symptoms as well, which doesn't help. And unfortunately, as a result of the acne, it can leave scars on the skin. It can also change the color of the skin, causing either hyperpigmentation or hypopigmentation, depending on the color change of the skin. And this is why it's so important that if you do have acne, that you speak to your healthcare professional. No matter how small it is, speak to your healthcare professional if you haven't already. Make them aware of it, keep them updated, just so they can look after you and guide you in the right path. The last thing you want is to get scarring from the acne, so it's super important that you involve a healthcare professional in your treatment. There are also certain medicines as well that can make acne worse, so if you are taking any medicines, please speak to your healthcare professional, make them aware that you're having acne, you're having these problems, and they can check to see if that medication is making things worse as well. Please do not just stop taking that medication without speaking to a healthcare professional. It's super important that you speak to them first and get their advice on it. There aren't many tablets or medicines that cause this, but it's important for you to be aware of it. So now let's move on to when you should speak to your healthcare professional. The first thing, the most important thing, again, that I want to make you all aware of, is if you're noticing any drop in your mood, or if it's someone else that you know, if you're noticing any drop in their mood due to the acne, please, please, please direct them to their healthcare professional. Or if it's you, go and speak to your healthcare professional. If you feel like your mood is deteriorating, if you feel like you're having more negative thoughts, if you're feeling more anxious, if you're not taking pleasure in the things that you used to do, if you're having any thoughts of self-harm, suicidal thoughts, anything like that, please speak to your healthcare professional. That is the most important thing. And remember, acne can be treated. There's loads of treatments out there, and this is going to help with your mood as well. So please, if you're having low mood as a result of the acne, speak to your healthcare professional. And as I mentioned earlier, severe acne such as nodular or cystic acne, where it's under the skin and it's deep and it's big and it's really painful, make your healthcare professional aware of that. Speak to them, make them aware of it. This is super important because if they're not treated properly, they could get infected, they could get worse, and they could even cause scarring. And lastly, if you are pregnant and you're having an acne breakout, please speak to your healthcare professional, get the advice from them, because certain things you cannot do whilst you're pregnant, so it's super important that you speak to your healthcare professional about it. So that's the end of this week's video. You're now a bit of an acne pro. We now know all about the lifestyle tips for acne, we now know all about the treatments of acne, we know what causes acne, and we know when to seek medical attention for acne. So you're a bit of an acne pro, so tell your friends, tell your family, tell your loved ones. If you know anyone with acne, help them out, give them a bit of information that you've learned from today's video. And as I always say, sending you awesome vibes, and I'll see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow, or subscribe button now to stay up to date with new weekly videos.